Welcome back. Hi, Anna. Welcome. So, as you know, we have several workshops going on at the same time. And this is the hydrotherapy workshop and natural remedies tomorrow. We are doing our second session today. I don't see anybody new basically, so you know about the handouts. Some books are by donation and some are, you can take them. This was $16. It has a price tag on the back. And it's a book on hydrotherapy by Dr. Charles Thomas. And this is God's Healing Way. It's a donation of $5 to $10, whatever you're able. By Dr. Marianne McNeilius. So it has these things a lot of the applications that we're talking about. It has that in there. So these two books are somewhat similar, but there are differences. They're written by different authors, and they have some different information. And the Ministry of Healing also over there. Today, in this session, we're going to cover practical applications. And we already started a little bit right before this. And I just want to remind you that it is important to know what sort of person you're dealing with, what sort of person has the actual ailment, instead of thinking more about the disease that a person has. So always think about the person you're dealing with more importantly than the disease, okay? Because you want to make the application practical and useful and efficient for that person. I also wanted to mention, as a segue from our last presentation, my dad never got a sick day. He never took off sick from work. When he would get a cold or a flu come on, he would take a fever bath, go sweat it off, sleep it, sweat it off. Next day he would go back to work. And he responds very well. I don't break a fever very well. He responds extremely well to hydrotherapy. And he's just never gotten the flu or the cold. And that's amazing. He also takes cayenne and he takes garlic. And those also help, and we'll cover some of that tomorrow. But I just wanted to mention that. And I also wanted to mention that a couple of years ago, when I was doing the Dr. Nedley's program, the Depression Anxiety Recovery Program, I was helping with it. And the challenge in there is that you should do a hot and cold shower every day. And so I said, this is starting in September, and by Christmas, I'm not going to get sick. I don't want to get sick. I will not get sick over the holidays, because I used to always get sick over the holidays. So 4 months, every time I showered, hot and cold, hot and cold, hot and cold. At least 3 times, 3 reps. Well, do you know I got sick? And do you know why? I know why I got sick. I got very angry and very upset. So your mental attitude matters very, very much. You should do the things, the lifestyle things that we're teaching you, the therapies, the treatments. But if your mental attitude, if you don't have love, if you don't have forgiveness, you're not going to get very far. And actually, I want to put in a plug for the seminar. If you have registered, you will find a flyer in that little gazebo in the registration. There's a flyer for the Law of Life seminar. Dr. Horst Müller is coming from Germany, and he's talking about the mind-body connection, how our thoughts affect our health. So you want to come to that seminar in October 18th through the 26th. Pick up the flyer. I will make sure that I have a sample of it at the end. Okay, so I wanted a volunteer that has some pain somewhere. so that we can do an ice massage. What is an ice massage? So basically, an ice massage helps with sports injuries such as muscle strains or tears, sprains, knee or joint injuries, bursitis, sciatic pain, back pain, whiplash. And basically, the way you do it, you fill up a styrofoam cup or a paper cup with water. You place the cup of water in the freezer about approximately 8 hours. And after it's frozen, the treatment, you peel back the top of the cup. So let me get the cup. And here it is. I peeled off the top. Then you want to rub the ice off with your hand so that it's smooth and you don't cut anybody. And you place a towel, to catch the melting ice. You rub the ice on the intended area and directly on the skin. You use a circular or long stroke back and forth to cover the painful area and the surrounding soft tissue. You keep moving the ice to prevent the frostbite. So always move it, always move it. And do not massage on the bone, to avoid aching. So the procedure, it's an acronym. It's called CBAN. It stands for cold, burning, aching, and numbness. When you do this, the person receiving the treatment feels cold at first, then they feel a burning sensation, then they feel an aching sensation, and then numbness. And you do that for about 10 to 15 minutes. It really depends on how large the area is that you're treating. And if it's too painful, you stop for a few seconds only, dry off the area, and then you want to go through those stages. And to finish the treatment, you have a gentle massage to the area and make sure that they're feeling good. So, we didn't know. Yeah, that's a little bit iffy. Yeah, so it's an iffy area. And I thought we might get Glenn. And while we do that, Brent can go through this. And Brent, well, actually, we're going to go off to the side. Brent can cover for us the next treatment, which is the wet sheet wrap. So Brent is going to cover the wet sheet wrap, and I'm just going to really briefly tell you, you remember wrapping does make us secure. There are some contraindications if you are claustrophobic or unable to warm up. You want to, there are 3 stages. So the first stage, we have we want to decrease the fever. The second stage is the time when the nerves are being calmed down. And the last stage is a detox or a heating stage. So the first stage is about 10 to 15 minutes to decrease the fever. The second stage is a neutral stage. It takes about 1 to 2 hours. That's what you experience, after the sheet wrap. It helps to calm the nervous system. It helps with anxiety or panic attacks. It helps people with nervous exhaustion, seizures, activity. And also, as you go into the third stage, that helps with detox. Helps with smoking cessation, alcoholism, flu or bronchitis, scarlet fever. I actually had the swine flu back in 2009. And of course, I didn't go to the doctor, but I knew it was because I was sick for 2 weeks I was so sick and nothing was working. And I called a friend and she said, do the wet sheet wrap. And so I did the wet sheet wrap and it helped, but still it took a long time. So the procedure, I'm going to have Brent actually go through it and he'll explain step by step what to do. So.
Okay. Really nice. This and a steam bath is great for people that are detoxing, maybe tobacco or some other drugs. They're trying to cleanse the body or cleanse it out of them. This is great. If it's a smoker, you want to be careful because whatever sheet you put around them, it's going to be stained for life. The things that come out of their bodies, the nicotine and the tars, will stain those sheets forever. And you won't be able to get it out by normal laundry anyway. But it does work. So as we're giving this treatment, remember we're getting them out of a hot bath. So the person is hot. Now be careful because if you get someone up out of a hot bath, they're likely to faint. It's possible that they could faint. So you want to get them up slowly and be in communication and know that that's a possibility because all of the blood is pooled maybe in the low areas and you don't want them to faint. So just be careful with that. But if they're able to get up quickly, quick enough, you take them from the bath and you're going to wrap them with a wet sheet. And it's great if this wet sheet can be in ice water. So you pull it out of a pan of ice water. Thank you so much. This is very cold water. Her hands are screaming with aching pain. And she's wringing out just enough, but not too much. And then she's going to wrap it around this poor Joe here.
Well,
Just wrap it around.
No, we need someone here.
We need someone.
No, you move. No, okay. Renee? No. Come. Oh, come.
Okay. Now Cindy she's just got out of the hot tub and looks like we're going to bring her to the table. This is a wet sheet, of course, and it's cold. She's lying down and actually it feels good because she's hot. And we're going to take it as far as we can. Taking that as far as you can. Yeah, if it was, it'd feel good, wouldn't it? Okay. Leave the face exposed, of course. All right. So we're...
This ideally...
sheet is a bit short, right?
Well, ideally this would be... I want to speak to that. This would be a longer sheet. But I only did that to show you with the ringing part. So let's do it with the longer sheet underneath. Because what you want is the sheet to cover every part of the body. And so hand out. So this is on the naked body. Well, they can have underwear. Okay. And this comes out, and then this, right?
Do you have a cold sheet and a warm blanket underneath, or no? What is blanket? Doesn't matter.
The blanket is, usually we'd use wool, a wool blanket, but the sheet will be between. All right, because we want to hold the heat in. And this white sheet is actually a wool blanket here, this white sheet.
Well, this, you can have 2 blankets, and this is to keep the heat in.
And also
And then the
save
wool
the
blanket.
save the bedding from being saturated with water and with sweat.
And then this would be the wool blanket at the very end.
Okay, thank you.
Because we added the plastic.
You should be getting warm about now.
I am
Yes.
already there.
All right. We have used this treatment also for cancer and for detoxing. And it's amazing how much liquid will come out of a person. And of course, the plastic will hold all of that liquid in. So when you unwrap the person, there's a lot of liquid that comes out of the body from doing this treatment.
And you want them to rest here, and they will be, it's ideal if they rest between 4 to 8 hours, because the body will be working. And
You rest like this,
yes,
wrapped up.
Okay.
Before nighttime.
yes, make sure that they go out to the bathroom.
Yes.
Mhm.
You want to keep the head cool. And usually during the first initial part of the treatment, probably the first hour, you want to be watching. We have ice here, and this is ice water, so we're bathing the head with a cool cloth, not real saturated, but just keeping it cool. We've taken temperature readings, and we've taken people, and when they first get out of the tub, it'll initially go down temperature, but we've had a rebound in temperature within the first hour, and we can hold them about at the same temperature we got them out, and then it goes down slowly after that first hour. But we've had people over 101 degrees for 3 hours. It works.
How do you do it for children?
For children, of course, children, you aren't extreme with anything. You be gentle, and I would just do it basically the same way, mechanically here, but just gentler.
Because someone had that question earlier.
Do you have a thought?
If they have a high fever, would you do this to decrease the fever?
Yeah, you could use it to decrease the fever, of course, with a high fever of a child. And a hot bath is great for a high fever. It may seem contraindicated, but it'll bring the immune system up in the body to fight the problem, and it usually deals with it. That's been my findings.
And make sure that the person rests afterwards if they have sweated to clean. No, you keep it because you're doing fermentations.
Okay.
All right, let's unwrap her.
Yes. Also, we have done it where the person's foot is in, the feet are in hot water during this treatment. It's a variation of the treatment. I don't need to go there, I suppose, but that helps to bring up their temperature. That's in the case if you don't have a hot bath to put them in first to warm them up. You can use a hot foot bath to warm the person up. Very good.
Fermentations next or foot bath?
While they're getting the wet sheet pack, it's good to keep your patient hydrated. So if they're in the room with another person, that can give them, sips of water, and you're thinking, I'm going to be in this pack for 4 hours and I'm going to get hydrated. Well, first you're going to be sweating off a lot, but you feel like you have to urinate. But get a Chucks. Get something that will catch it if you have to go that way. Some people say they can't imagine wetting the bed at this age, so they can't do it, and so they have to get out of the pack.
I don't feel good.
Oh,
I
honey.
don't feel good.
Come. Let's see. I think we have you. You can. And actually, this is how he acts
I don't feel good.
when he's sick. And usually, if he's coughing a lot with 2 of these treatments, one in the morning, one at night, I'm done. I don't have to keep labor, intensive. So we're going to do a chest revulsive. That's hot and then cold. Okay, we're going to act like he has pneumonia. I have a friend once who did a fever bath with pneumonia and got worse. But with just doing the chest revulsive, I think you're going to find relief from a flu or any kind of cold. Okay, so I don't know where the trash bag was that was under here. Trash bag. Usually you put down a trash bag to catch some type of plastic. We'll pretend that we have a trash bag under here, so then I don't get all the linen sopping wet. Because what I'm going to do is I'm going to have a basin, which it's just right here, and this is going to be full of hot water. And of course, I'm going to have him, I've tested it with the back of my hand to make sure it doesn't burn him, okay? And so I'm testing it, it feels fine. I say, just put your heel in there. How's that? Too hot?
Nice.
Okay. And of course, they're bare feet, everything's off except, the underwear. So here we are, and we cover them up. And we do have cold to their head, too. So we might have a cold cloth, but not initially, because that would be miserable if you weren't sweating, right? Or if you weren't hot. And so how are you doing, sir? How are you doing, hon? You need a foamy to your back. You do, don't you? Thank you so much. I knew I had to ask you a question. But the most important, I just wanted to read a text very quickly. But most profound that I was reading it today, talking about foot washing. And it's not really the act of foot washing. I'm going to use you as a desk. That's so humbling. But if we turn to John 13, it says that love is what does the work, okay? And even if this is our enemy, one time I had to give my enemy treatments. Do you know that? I had an enemy. And I felt I could never love this person because they were kind of saying some bad things. But when I looked at them at the end of the treatment, I said, I don't care if you ever love me. I love you. And it was powerful. So it says, infinite love could do no more to bring Judas to repentance and save him from taking the fatal step. If this service of his master in humbling himself to wash the feet of the worst sinner did not break his heart, what more could be done? And so we always have to invite Christ's presence. I have done a treatment where you think this is a simple water treatment. What harm is that? Well, I didn't know that the person had congestive heart failure, okay? So they felt fine. They were sitting back. But when they got up, it was a whole different program. And I said, Jesus, come now. And that person survived. But you always want to invite the true healer to your service. And then I want to end with this. We are led to love as brethren, to be kind, tender, courteous in daily service, having hearts that can feel another's woe. So I thought that was pretty cool. So I'm going to pray. Dear Lord, these people are just learning these simple remedies. They work. There's power in them. These are the remedies that we'll have till the end of time. One day we will not be able to go around to the physician. And hopefully we can find the great physician faithful now. In Jesus' name, amen. We know we find him faithful. Okay, so my husband's coughing. I better get with it. Can I hear with this thing? I don't need this anymore.
That's only for the camera. For everybody else.
Okay, sorry. Okay. Yeah, so I actually have him not on the table yet. What I do is I have a fomentation. What you have here is a a turkey roaster, which you can get at any Goodwill for probably $3, okay? So what's putting up the steam, these are damp when you put them in here, so these are super hot. I would never pick them up with my hands. I'd have tongs or mittens. So I have cooking mittens, and I lay this down, and what I want to make sure of, first of all, is that none of this is exposed, okay? Because it's super hot. You're thinking you would never want to burn or irritate the skin of the patient. So you have wool blankets. And I'm going to show you how to make a simple fomentation. If anybody knows how to sew here, it's very simple. These are wool blankets. And say you don't have a wool blanket, just put 3 layers of towel, okay? So I put the wool blanket down. I cover all of it to make sure that he's not burning. So he lays back, and I put the pillow here. All right, how you doing, sir? Okay, I need the wool blankets to cover. So I have another basin. I don't know where. Where's the black basins that we brought? Okay, good. Okay, we have a basin full of, here we go, full of ice. And you might want to use these washcloths if that's all you have. But I had some mittens. And these are very convenient. These go on the hands. So they're very easy to do cold mitten friction to the heart. So I stick those in there with this ice water. And I get the next fomentation ready. I've said the prayer. And this is out like this. What you do is you take a wool blanket from the Army thrift store, cut it into 4s, and then you have your wool blanket there. This way? Okay. All right. I think it's the other way. Ours are not too short. Oh, okay. I don't know. Sorry about that. Okay, so this should cover it. And we also have down, I don't ever do this, there's another table here. I lay the fomentation on, and I have 2 towels that I put down initially on his chest because this will penetrate quickly. And for example, I ask him now, because he's laying on this heated pad, how's it feel? Is it burning over here or too hot? And it doesn't matter what you think, it matters what he thinks. Always respond to your patient's needs. If they say it's getting too hot here, then you put like another piece of towel or whatever underneath them, okay? Because they know what they're feeling. Okay. So I put this is doubled. Put this here like this. I need another blanket, another towel. Okay. So I actually only want 2 thicknesses. This is big enough. I lay this fomentation down, and then I cover it with the towel to hold the heat in. So then I wait 3 to 4 minutes of the hot. And of course this is getting really cold with the ice. So then you always want to make sure that when you apply the cold, after you dry it very good, because water drives heat, okay? So we have the heat now, that is good. And we have this up here. He's starting to sweat. Yeah, he can lift it up a little bit off himself. And now we have the cold cloth we put to the head. How are you feeling there? I might give him a drink of water. So this one's done. I pull this back, leave it right there, and I go ahead and get another fomentation out and wrap it. But before I do that, excuse me, I'm going to go ahead and go back like this. Yep. So I'm ready with this ice cold mitten, and I say on the count of 3, are you ready? 1, 2, 3. Woo! So do this, and then I dry with a hand towel because, like I said, the wet drives the heat, so we want to make sure that we don't have anything wet there. And then we put another fomentation for 4 minutes, and then cover it. Give him another drink of water. How's your feet, sir?
Needs to be warm.
Needs to be warm. Okay, so we have a pitcher or we have a tea kettle full of hot water, and we tell them, I'm going to just expose right here. So we tell them to lift this leg over this one, and so I'm using my hand as a barrier, and I'm pouring into here, and as I pour, I'm swishing, and I say, how's that? How's that? A little more? Okay. Okay, okay. So now you can put his feet down. That way, if you use your hand as a barrier, you're not going to burn him, okay? And you're letting him do the judging of the heat. Okay, so it's been 4 minutes, and I do another application. Just pull this over here, and what do you say? Okay, this is my third one, and I have the mittens nice and cold. Are you ready? 1, 2, 3. Okay, and usually I do not have to do more than 3 changes, and I also now want to focus on cooling him down. So we always make sure the blood circulation goes to the heart. So I'll have him sit up, and if he's sitting on this, I'll just say lift up just a little bit and pull it out. And then I have the hand towel in the cold. Whoops. And so I say, this is already wrung out. I say 1, 2, 3. Woo! Okay, dry him off a little bit. Let him lay back down. He's going to be sweating anyway. Okay, now he's up like this, and I do his arms. And that's what's so great about these mittens, because they stay on your hands and it's easy to maneuver. So I'm just doing friction like this. Towards the heart. That's right. And then I dry his arm, put it under here, and then I do the other arm, and then I dry it and put it under here. And then the funnest part actually is this part. No, I'm just kidding. We take part of this basin, and I don't pour it all because I need to use it for the legs, but I'll say on the count of 3, lift your feet, and I pour the ice water over his feet. The plastic that was here I take out, I dry his feet, I put on socks, and then I go ahead and do the mitten friction to his legs. And he likes this part, so I have to do it vigorous. He says, don't do it light. So you just rub there all the way to the heart, and then dry a little bit, both sides, and then he rests for, I don't know, 20 to 40 minutes, and that's a treatment. And usually after doing that, he's contented. So usually after that, I do one in the evening, and then I don't have to ever treat again. And It's very, very advantageous. Now, if the person had pneumonia, I might do one other thing, and that is have him roll over on his front, have his head off either that way or this way, and I do cupping. This breaks up the secretions, and so then I tell him, take a deep breath in, blow it out, take a deep breath in, blow it out, and on the third one, cough. He's very dramatized. No, dramatic. Okay, and that's usually all we do. So, whoops. I want to stress that there are some other reasons that you use hot and cold fomentations. You might have a liver problem, so you might use it on the abdomen, okay, instead of the chest. You might have arthritic joints, but you're going to do it a little bit different because the cold is, you might not end with cold, you might end with cool, so you don't cause more pain to the arthritic joints, okay? So when you look at this God's Healing Program, the wonderful thing about it is it will have pictures. They're the old-fashioned pictures, but you can see they work. And she also has contraindications when you wouldn't give this type of treatment, okay? So it's very beneficial, even like we've been doing these for years, but I like to look at them periodically just to make sure that I know the contraindications, because I don't want to be, I want to err on the side of knowledge and goodness. Thank you. And the other one was hot foot bath. Okay. Hot foot bath might be for somebody who's had painful menstrual cramps, high blood pressure, headaches, fatigue, or for a young child who's dealing with flu-like symptoms or a cold, okay? So you can help boost their immune system, and they'll be, I only need one. Yeah, I'll use that one. Okay, so, hon, you're the one. Let me get it ready. Just a minute. You want to have basically the same application. I'll use this, both of them, yeah. Okay, so you'll have a sheet and a wool blanket.
Together?
Yeah, together.
I can hold. I can do it.
Okay.
Tell me.
And you'll drape it over the chair. This is a treatment you could also give to yourself. Say you're just totally fatigued, okay? And you can't get any rest and you feel wiped out. This will help kind of give you that extra rest that'll give you the energy that you need later, okay? So you can actually put your feet over into the tub and have this in the tub, and then add your hot water as you need it. Or say you're dealing with high blood pressure. High blood pressure dealing this way takes a long time, but then you don't have to have the pharmaceuticals chasing you. You know what I'm saying? If you're changing the diet, changing the salt intake, you're doing the hydrotherapy, your blood pressure comes down, you're like, wow. I was a dorm mother, and I had a student who was older than me. She had super high blood pressure. She would give herself this treatment every night. She was faithful. And then she didn't have to have the blood pressure medicine anymore. But one thing with blood pressure medicine, you can't just say, I'm starting this, now I'm going to stop this. No, you can't take yourself off high blood pressure medicine like that. And you have to follow the doctor's protocol for cutting it down and getting rid of it, okay? So here we are. Can you hold this?
Yeah, I'll go over after she does it.
Okay. So we have him wrapped up. Whoops. That's a little shy. We'll pretend like it's all the way. And this is, again, hot water, as hot as he can tolerate it. What is your ailment today? Do you have high blood pressure, a headache, or? Headache. Okay. And I've given this quite a bit for people who have headaches and headaches at the Lifestyle Center. They might be detoxing too fast or different things. And so this is a very simple treatment. It only takes 20 to 40 minutes, 35 minutes, okay? So you have your hot kettle over here, and he's basically just sitting here sweating. And when that cool breeze comes in, that reminds me that you do not want to have cold. You don't want them to get chilled, because the treatment will not work and they could get sick by being chilled, okay? So you want to have it in a room that's a, normal temperature. So how you doing, sir? He's starting to sweat, so I'm going to have that tub full of ice, and I might actually even give him a little turban and just leave it on there for a while to cool him down. And the one thing about a headache that you don't want to forget is ice to the back of the neck. If you forget the ice to the back of the neck, you'll give them a worse headache. So what did I just say? If you forget what? Ice to the back of the neck, you'll give them a worse headache. So you want to push the blood to the feet. And so how you're doing that is you're dilating at the feet, making them warm, and you're making sure the head is nice and cold. And I give him some more to drink. And one thing you're going to be focusing, I know the chest, the revulsive, you were focusing primarily on the fomentations. Here you're focusing on keeping this water as hot as they can tolerate. So you're going to say, you need some more hot water, and you're going to come down here and do the same application. The feet are crossed. You're going to pour the water there and make sure, how's that?
That's good.
Okay. So basically they're just sitting here warming up. And I want to put some more cold on.
Also, there has been occasions if someone does have a headache, you can do a nice shoulder neck massage during the hot foot bath, and that will often help relieve that tension.
Yeah, I thought he was wanting, hint, hint. He wanted me to learn how to cut his hair before we got married, so I had to learn how to cut hair, and then I have to give him a head massage after I cut the hair. So see, there's always a reason behind. So basically it's been 30 minutes. I stopped the treatment, and this time I always end with what to the feet? Cold, okay? Because I'm going to give the blood a little bit of boost so when he stands up, he doesn't fall over. So here's the ice. I just have him lift up, and I have a towel underneath his feet so he can put his feet down on a nice towel. And then I have him go to the shower, okay, and cool down a little bit, and then he can rest. Always after the treatment, you want to have a rest. So hopefully you'll feel invigorated.
My headache is gone.
Contrast foot bath.
Contrast foot bath. Okay. No. Contrast foot bath. Some of the things that you want to be aware of, it's very, very important to, no, I need yours. Oh, she's going to be the volunteer. Okay. Well, she can just say she's just clothed like this. This is perfect. But what if she has diabetes, or what if she has profuse swelling? I'm going to make sure the water for the hot is no more than 101 to 102. These people cannot feel, they have a loss of pain receptor, so she may not be able to feel the heat, and it may be actually burning, Okay, then we have a blister, we have problems, and it's worse than what we started with. Okay, or the swelling. And so we want to start, but say she just has a sprained ankle, and we want to bring blood supply there, and or I have one friend who had, what'd she do, cut her leg or something? I don't remember. Anyway, I think she broke her leg. She wouldn't be put in a cast because she knew how beneficial hydrotherapy was. So she said, you can put me in a boot or you can put me in something like that, but I have to do hydrotherapy. She cut her tendon with a chainsaw. So they were going to cast her all up, and she said, no, no, no. And she went home and did hydrotherapy, and so she would heal a lot quicker. So this is we're going to do both feet into the hot, and say this is do you have any diabetes or swelling today?
No.
No, okay. Yeah, we were coming with a sprained ankle, I forgot. So she has it in hot water. What do we have it at? 110, 108, somewhere around there, okay? And then this is the cold water, and we just do, yeah. So say she's been in this for, I always do 3, 3, and 3, just what I do with the shower, but she did a little bit different, so I'm not sure what you want to do.
Cold a little shorter, but.
Okay, okay. So I think you were saying 4 minutes of hot. 4 minutes of hot, and then the 30 seconds of cool, and then 4 minutes of hot. And this is something you can do for yourself. But if it's a child, you're going to want to do that for them. Or say it's an injured arm, like this fellow in the back has. He's going to do hydrotherapy with his arm.
At the same time.
Not at the same time.
I know, ice pack on my head.
No ice pack to your head. We're just treating the extremity, okay? So we don't have, what she has on is just perfect, okay? And it's amazing. Like somebody who has sepsis, I heard of a lady who did have sepsis, blood streak right up her arm. It's very deadly. She did hydrotherapy. She took the garlic. She did the, lots of drinking of water, all the nutritious stuff you're supposed to do. And she was fine with just hydrotherapy and the things we are taught. Has that been? So, yeah. So again, what are the two things that we want to be sure that we do? And that is, if we look at this person, we ask them their condition, we find out the real problem, okay? Because we are treating her as an individual. So like she said, that text, it is so important because they can look in a fever bath like they're absolutely normal until they get up. That's when you have the problems if you have congestive heart failure or say she has cellulitis. I would do hot and cold. I would do everything I can to bring healing to that leg.
Thank you, Shari. Okay. Are there any burning questions regarding that? If not, we can leave it to the end. Okay, very good. We got 2 more. How we're doing on time? What's our time? It's okay, so it's almost 12. So we'll just go over this really quickly. The contrast foot bath, extremities, contraindications. She mentioned it about diabetes and peripheral venous disease. You don't want big contrast. You want small contrast. And congestive heart failure, you want to check with the physician for that. Okay. Like I said, it's not the exact science, but it's the understanding or the principle. So you have 1 minute hot, 30 seconds, 1 minute to 30 seconds hot, 10 to 15 seconds cold. You can do 4 minutes hot, 30 seconds cold. It really doesn't matter as long as you have, the colder application is a little shorter. You want to keep the temperature stable. And we went through all of those. Steam inhalation, I just want to mention really quickly. This is very good for sinus problems, for chest, upper respiratory problems. And basically, you want to have a kettle, and just doing it really simple. People can do this complicated, but do it really simple. You can put in here some salt water. You can, after the water has boiled, you can put a teaspoon of salt water. You can put 5 drops of peppermint oil, eucalyptus oil, any other things. So there's the additives here, oregano oil, and you just put this over your head. You make a kind of like a tent here. You cover everything so that the steam does not go away, and you basically inhale that for as long as you can and as long as it's hot. And that will help your sinuses, it will help upper respiratory issues. It really opens you up, especially adding the essential oils. One important one, if you have a sore throat, you want to get a little, I didn't bring my little strip of flannel. Do you have, Brent, a little strip of flannel? I didn't bring my little strip of flannel. Yeah, I hear missing. Just pretend this is a strip of flannel. You get it like from an old pajama, or something. So you put this, after you have a shower or a foot bath, a hot foot bath or a hot shower, you want to put this into ice cold water, a strip of flannel, put it around your neck. So you put a pin, you pin it, and then you put wool, a strip of wool, like a wool sock, and you put it pretty snug, but not to choke you, and you pin it, and you're gonna sit there for a few hours. You can go to sleep. You should sleep, you should rest. If it's a child, put your finger in and see if it's gotten hot. It's supposed to get hot. So you have an ice cold, wet flannel that you put underneath. Your body temperature will make it hot and it will dry it. So it makes your immune system fight. And so, but with a child, you don't know whether, if they're really working well. And so you want to put it in. If it hasn't gotten hot within the first hour or so, would you say, then it's not working. So don't do it. But the point is, you have to have gotten hot within the first hour or so and rest. Okay? Anything to add?
Yeah, just the same idea that on any of these treatments, with this treatment or with the cold sheet treatment, if the person starts to chill, abort. Just abort the treatment because you don't want them to chill and it'll make things worse.
Mm-hmm. Yeah, very good. So no drafts in the room and things like that. And that's the heating compress. And so a wool or cotton strip completely covered with the, so we didn't do it, very perfectly because we're running out of time, but completely covered with the wool cloth. And you leave that for a few hours. Yes. Okay. So are there any questions about the things that we have covered in this session? Sure. So she's saying that her mom used to put a little piece of sheet. So that's cotton or flannel. and a small piece, and the wool should be larger so that it covers it completely. Thank you. Any other questions or comments? Okay, very good. I do want to make sure that you each get one of these. It's an invitation to Dr. Mueller's seminar that's coming in October, and so I'll pass those around. And if there aren't any more questions, then Shari has one comment. Hold on.
Is 51 old? I forgot. I'm sorry. When we did the fomentation to the chest, when you put down the fomentation, you need to have 2 heavy towels like this. Double them. And you might need 2 or 3 doubled. Maybe it's because it's so important that I forgot it, right? No. But you have another set just like this. So you have 4 layers. You put that over the fomentation before the patient lays down. Okay? Thank you. Sorry about that.
You had the wool, and that was important.
Yeah, but you always put the towel down.
And the towel. So the reason is because if they get sweaty, that water makes the person, because of the heat, they will burn. And so you don't want them to burn, and that's the problem. If they do get hot, you either wipe them down. You know, you don't want to lose some of that timing in the treatment, so you wipe them down really well and put them back, or you actually change that towel and put a dry one. So on the actual patient, there should be no wet when you're doing fomentations, nothing wet. Always a dry towel or 2, depending on how hot things are, etc. Is that clear? And you know why, so that you don't burn the patient. Let's say that you don't have a hydroculator. You can do this in the microwave. I don't use microwave. It works very good. And so you get it cold. I mean, you get a towel, a wet towel. You wring it really well, and then you put it in the microwave for 3 minutes. In a trash bag, that would help. Inside it, and then you do the fomentations that way. 3 minutes, yeah. Okay. Thank you so much. Tomorrow at 9:30, we will have the 10 doctors that make house calls.